A stroke is a medical emergency and requires immediate attention. Early recognition of its signs greatly increases the chances of recovery. Here, we discuss the critical signs of a stroke you should never ignore. Sudden numbness or weakness. This often occurs on one side of the body, affecting the face, arm, or leg. It's one of the most common signs of a stroke. Confusion or difficulty in understanding. Stroke victims may experience sudden confusion or difficulty understanding speech. They might struggle to comprehend simple instructions or become disoriented. Trouble speaking. Slurred speech or difficulty talking is another common symptom. The person may find it hard to articulate words or form coherent sentences. Vision problems. A stroke may cause sudden blurred or blackened vision in one or both eyes, or even double vision. Dizziness or loss of balance. A sudden feeling of dizziness, loss of balance, or unexplained falls can be indicative of a stroke. Severe headache. A sudden severe headache, often described as the worst headache ever experienced, can be a sign of a stroke, especially if accompanied by vomiting, dizziness, or altered consciousness. If you are finding value in our content, please subscribe to our channel. It is also important to remember that strokes can have different symptoms in different individuals. Some may experience vision problems or dizziness, while others may have difficulty with coordination or balance. Knowing the signs of a stroke and being able to recognize them quickly is crucial in getting prompt medical attention and reducing the risk of long-term effects. Remember that time is of the essence when dealing with strokes. The acronym FAST is a quick way to remember and identify the most common symptoms of a stroke. If you suspect someone is experiencing a stroke, call emergency services immediately. Early treatment can reduce the brain damage that stroke can cause. There are also other important considerations when dealing with strokes. Age and gender. Strokes can happen at any age, but they are more common in people over 55 years old. Women tend to have a higher risk of stroke than men. Lifestyle habits. Certain lifestyle habits, such as smoking, excessive alcohol consumption, physical inactivity, and a poor diet, can increase the risk of stroke. Medical conditions. Other medical conditions such as high blood pressure, diabetes, heart disease, and obesity can also increase the risk of stroke. Family history. People with a family history of strokes may be at a higher risk themselves. It is important to address and manage any risk factors that you may have in order to prevent strokes from occurring. This includes making healthy lifestyle choices, regularly monitoring and controlling medical conditions, and seeking treatment and support if necessary. In addition to prevention, it's also important to know how to react during a stroke emergency. Proper first aid techniques can help reduce the effects of a stroke and improve the chances of recovery. These may include keeping the person calm, checking for any other injuries, and helping them into a comfortable position while waiting for medical help to arrive. Emergency response steps for strokes. When witnessing someone experiencing a stroke, it is critical to act fast and take the following steps. Call for emergency assistance. Dial your local emergency service number immediately. In many countries, this is 911. Monitor symptoms. Note the time when the symptoms first appeared. The type of stroke treatment may depend on how long symptoms have been present. Remember the acronym FAST to help identify symptoms of a stroke. F stands for face. Ask the person to smile and see if one side of their face droops. A stands for arms. Ask the person to raise both arms and see if one arm drifts downward. S stands for speech. Ask the person to repeat a simple phrase and see if their speech is slurred or strange. T stands for time. If you observe any of these signs, call for emergency assistance immediately. Do not administer medication unless advised by a healthcare professional. Certain drugs can make the stroke worse. Comfort and reassure. Maintain a calm demeanor and reassure the person that help is on the way. Monitor changes. Keep track of any changes in the person's condition or symptoms. This information can be helpful to medical personnel when they arrive. If you are finding value in our content, subscribe to our channel. Your information can be helpful to medical personnel when they arrive. Remember, every minute counts when it comes to stroke treatment. Acting quickly can greatly improve a person's chance of recovery. Lastly, it's important to understand that strokes can have lasting physical, emotional, and mental effects on both the individual who experienced it and their loved ones. It is important to seek support from healthcare professionals and loved ones during recovery to focus on a positive mindset for rehabilitation. With proper care and management, individuals can continue to live fulfilling lives after a stroke. The information provided in this video is intended for general educational purposes only and should not be considered medical advice. We are not healthcare professionals, and this content should not be used as a substitute for professional healthcare consultations, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare providers with any questions you may have regarding a medical condition. If you believe you or someone else is having a stroke, contact emergency services immediately. If you have found our content helpful, we invite you to subscribe to our channel. By doing so, you'll join a supportive community dedicated to healthful living, and you'll never miss out on our latest tips and advice. Thank you for watching, and we'll see you in our next video.